Well, hello, it's Dr. Singh and Dr. Hauk, naturopathic doctors here at Holistic Healing Arts. So today I'm going to give the floor to Dr. Singh. He's going to explain to us about vitals and what that means and why it's important and why it's part of every naturopathic doctor's practice to check for vitals.
Okay, so vitals we would classify, Dr. Hauk, as temperature, pulse rate, respiration rate, and blood pressure. So they're basic measurements of just body functions. It's important to do those as consistently and regularly as possible. So I'd like to sort of demonstrate, and thank you for being the guinea pig.
I'm happy to be the guinea pig.
So with blood pressure, everyone's familiar with blood pressure that gives a reading of two numbers.
Mm-hmm.
The first number is your systolic measurement. The second number is your diastolic. So simply put, it's measuring the pressure in the arterial system. The systolic blood pressure is a reflection of when the heart is actively contracting.
Mm-hmm.
The diastolic is when the heart is relaxed and filling with blood. Systolic, again, when it's actively ejecting the blood. So we're getting measurement of both of those readings. And obviously, if something is off with those readings, we never make a conclusion on the first time we measure it on a patient. We definitely want to do some consistent 3 or 4 measurements. Okay, is it too low? Is it too high? I know they say textbook is 120/80, but everyone is individual depending on age, what circumstances. It's much more complex, conversation, but for today, we're just going to be measuring on your left arm.
Your white coat might be scaring the poop out of me, and
I forgot to take it off because I was.
Oh no! Anyway, we'll see how we do today. Yes.
So typically, I like to do it on both arms, but for the sake of time efficiency, we'll just do it on your left arm. Okay, so your blood pressure is in a good, healthy range.
Good. Nice to hear.
So that's the blood pressure. Then we have this little thing here called a pulse oximeter. And this will measure your pulse rate, as well as oxygenation saturation. So I didn't mention that as part of the vitals, but it's going to measure your pulse rate, and it does give us a reading of oxygen saturation.
So it measures how many beats per minute my heart is beating, and it
Which is your
measures
pulse rate,
the
yes.
oxygen content of my blood.
Yes, we can think of it that way. Yes, and pulse rate is generally normal is 60 to 100.
Right.
So again, if someone comes in and I'm consistently getting 120 beats per minute, okay, is it anxiety? Is there some other underlying metabolic process that's going on? If it's too low, okay, is it because they're an athlete and then we would anticipate it would be low? Are they on medications where maybe that needs to be fine-tuned with the support of their family doctor? There can be all types of scenarios there, but 60 to 100 is considered kind of a normal pulse rate.
Okay.
So that is the number of beats per minute.
Right.
The oxygen saturation, personally, I like to see it 95% and up. If it's consistently in a lower range, then again, we want to investigate or refer that patient in. So typically, we can do it the old-fashioned way by measuring your pulse. And now people have Apple Watches as well, but we'll put this on your index finger, and it's going to give me a reading, and it's within usually seconds that I'm able to, once it stabilizes. And again, that all looks great.
Good.
And then lastly, temperature. So I have an infrared thermometer here, so it's going to kind of give it a zap here. It's not really a zap, I'm just kidding. And yeah, so you're 36.4 degrees Celsius. Temperature again, I would say a normal range, 36.5 up to maybe 37.2 degrees Celsius. that's kind of a rough range that we're
There's no
looking at.
perfect number, right? It's a range for so many of
It's
these
a range,
things.
and you know, when we're working with patients, Dr. Howe, you get a sense of their vitals when you're consistently doing them. So if something is off, then
Right.
I want to investigate and, okay, what's been going on? Is there anything that's changed in your health status? So yeah, that's basically Vitals 101.
Vitals 101.
Yeah.
And apparently I've passed. So
You have passed,
Next time
yeah.
we'll talk about 102, something 102. health. But these are easy things that can be done. They are done regularly in a naturopathic office, and they're an important piece of setting a foundation
They are, yeah.
when you are measuring changes in a person's condition.
Yes, yeah, and that's a key point. Yeah.
So thank you so much for tuning in, and we'll see you again next week.
Bye, everyone.